Hello students and welcome to this new session. We're talking about how to crack DNB exit examination, and today is a session to be done for practical exams. On the very outset, I want to thank again my heartfelt thanks to all my students who find my classes helpful in any which way. I'm very happy that many of you have already cracked your DNB examination. I want you to come up and we'll just kind of give a small interview on how you cracked the DNB exam, what all things helped you, so that your juniors, your other students can take kind of advantage of your experience and put their wisdom as well to use. Now, as far as the practical exam is concerned, students, the most important thing that examiner wants to see in practical is how much basics you know. Okay, whether you are fit to be given the degree or not. And in DNB degree, mind you, it's a little more difficult than MSMD, so you should be at least confident about your basics. That means if you start fumbling around on grips in obstetrics, or you start fumbling on the examination, the PV and PR examination in gynae, nobody is going to pass you. You know that very well. There are certain basic questions which are going to be asked. For example, in every case discussion, I try to show you how to answer which question. There are certain words which are not to be used. Anything that you do apart from the usual will bring the limelight on you and you'll be caught. So just go by the normal flow. See a lot of case discussions, lots of them are already there in my app, so you can go and see how to construct the case, how to speak the case, how to take the examiner to that point where you really want your lecture or your viva to go. You have done a ovarian tumor case, you want the viva to be around the ovarian tumor. Okay, you do not want it to go to ascites and percussion note and dullness and all that, and shifting dullness, and what is the level of ascites which will give you a shifting dullness and stuff like that. You do not want to beat about that place, because even that level I might miss out, because my focus is going to be on ovarian tumor rather than on percussion notes. Okay, so do not hover around that thing a lot which you are not sure of. That's number one. Number two, be confident. Do not go overconfident. Do not get meek. It should be in between. What you're speaking, you should speak with confidence, but with a lot of respect for your examiner. Anywhere the examiner feels otherwise, always say yes, sir. That's the way you've got to be. If you do not know an answer, just politely say, sorry, sir, I do not know it right now, but I'll find it out. So that should be the level of your confidence with humility. That's very, very important. Examiners want to see that. Nowadays, you have a lot of OSCE, so that means one portion of it is kind of skipped. I do not know whether how many of them are still taking you for ward rounds, but maybe that is also now being included in the OSCE. So that thing is like kind of saved, because that in that case you're not directly in front of the examiner. You get some time to remember as well, but you can practice OSCE when I come up with that thing in my app. The other very important thing about your your practicals is that try to speak in front of the mirror, because that will give you the flow. If you keep stopping in between that kind of stammering, stuttering, that is the place where examiner catches you. Okay, the moment you make eye contact, listing few things, and then you look at the examiner and you give a pause, examiner stops you there and then starts asking you a question. But if you in flow, you keep going with okay pauses in between, so much so that the examiner is able to comprehend. Also, if he wants, he can stop you also. If he wants, that he's finding that you are confident enough and you're moving away, he'll understand that she already knows this thing. But if you stop, stutter, you kind of not confident about his finding, examiner perceives that. So you have to be okay, confident. Even if you're giving an answer, give it with confidence. So for that, a lot of you have requested me for live classes. I'll be coming up with those live classes. It's just not possible right now, because for a live class, in that case, I'll need everybody to be free around that point in time. So that is not really feasible, because so many of you have night duties, some are post night, some are evening duties. So it's kind of getting difficult to form a batch and do the live classes, but I will be doing it in the near future. Maybe taking a batch from a particular hospital or a particular year or something. So that I'm trying to figure out. But yes, practice for speaking in front of mirror, in front of your colleagues, in front of your seniors, in front of your mentors. But speak. The more you speak, the more you'll understand how to speak in front of the examiner, which is the most important thing. Because if you speak something which is not which was not required, then examiner is going to catch you there, and you don't want that. You do not want to venture into that field where you've not prepared yourself for. Okay, and remember one very important thing: whenever the differential diagnosis is concerned, please, no matter how many times examiner asks you, this kind of tip and trick I had given before also, that no matter how many times they ask what else, you will not jump and say the syndromes. Okay, the rarer forms of the thing. You will stick to your most common and most obvious differential diagnosis. You will not hover around the syndromes. And if you are going there, you should know at least 2-3 points about that syndrome. So this is what I wanted to say about practicals. And again, thank you so much for everybody for showing the enthusiasm that you are showing for on my app, for my sales. I am so sorry that I'm not able to carry on the sales for a longer duration of time. They're usually curtailed in a day's schedule, but I'm planning to, kind of, earlier on I used to give like a month long sale. And now they've curtailed down to one day. It's just about the entries actually. So, but I will be coming up with that sale again very, very soon in the near future. So just stay tuned with the app and stay tuned with my classes. And your queries are most welcome to me all the time. So feel free to approach me at any given time. Thank you so much.